Mr. Speaker,
Even, yeah, it's the one of mine.
the Rand Memorial Hospital is no exception. I know that the individuals in Grand Bahama, they too cry of the same problems that we have here. They too cry of the situation that they face in their emergency room. And we are embarking on renovation of their emergency room so that they too can be treated in an expeditious manner and treated in the comfort that they so readily deserve. And we have commenced already the renovation of a rented property on Coral Road. Then, after completion, our outpatient clinic at the Rand Memorial Hospital would subsequently move to Coral Road. And our emergency room can now move to outpatient, so that rather than doing a patch job like we've done in the past, where we try to work around patients, thus exposing the patient to all the hammering and all the dust and subsequently respiratory problem, rather than working that way, we would prefer, and what we are doing is moving towards moving all patients out so that we can repair the emergency room quite readily. The vaccine emergency in the Rand we expect to commence in June of this year and to be completed by March of next year. Mr. Speaker, there's also the cry within our institution. There's a cry of individuals from both New Providence and the Family Island of delay of surgery. There's a cry that it may take them 3-6 months to have a surgical procedure. And yes, we consider that a delay within the Bahamas. But when we compare that to first world nations, that is not considered a delay. When some nations may have delay in excess of 1 year, but our delay may be 3 or 4 months. But we cannot accept even that. We must still strive to do better. And when you look at what causes our delay, many times surgery is canceled because individuals cannot get a bed in ICU. And yes, I agree with the doctors. You should not operate knowing that that particular patient needs a bed in ICU after surgery. That would be gross negligence. But the public and others may not necessarily understand this and therefore blame the institution for a delay, but a delay that is necessary in the interest of the patient. But, Mr. Speaker, our institution has a 9-bed ICU unit. And we recognize that today we need to do something because we cannot continuously accept that, oh, the delay is because we have no beds in ICU. And that is why we're introducing a step-down unit so that individuals can now be admitted into the ICU, because other individuals within the ICU can be moved to a step-down so that individuals can have their emergency surgery or surgical procedure performed. We will be extending the capacity of our ICU beds. Mr. Speaker, the other problem we are confronted with a limited number of theaters, and we are expected to commence construction in September of this year of an additional 3 new operating theaters. And Mr. Speaker, that is important because we would now be able to perform more outpatient surgery. The problems we face today is the average length of stay within our institution, Princess Margaret Hospital, is about 7.8 days. The average length of stay in Doctors Hospital is about 3.5, and the Rand Memorial is about 3.1. Princess Margaret Hospital, we know today, is about 38 beds short. We also know today that if we performed more outpatient surgery, then we would be able to cut down on the necessity for bed space. And we'd be able to cut down on the average length of stay. And Mr. Speaker, Once we decrease the average length of stay from 7.8 days, we decrease that by 1.5 days, which is achievable by doing more outpatient surgery, where individuals come and go. You free up more beds so that those beds, knowing that we have 38 beds short, knowing that we cannot today introduce extra beds, it is necessary, therefore, to keep individuals healthy and keep them away from that bed. We know that the additional 3 theaters would do that. Mr. Speaker, by decreasing the average length of stay by 1.5 days, which is achievable, we would be able to save $14 million per annum. Not only that, we would be able to reduce our bed occupancy, which runs a capacity of 81%, considered full capacity in today's modern society. We would be able to reduce that to 66%. And Mr. Speaker, yes, again, Iran is no exception. They too would be treated similarly, because they too feel the pain that we feel here in New Providence. They too are part of this One Bahamas, and they should not feel the pain and continue with the pain that they feel today. One additional operating theater will be constructed at Ryan Hospital, and this work is scheduled to begin this month with a projected completion of May 2001. The tender for this work has been received. 2011. The tender for this work has been received, analyzed, and finalized by a selection of a Grand Bahama contractor. Mr. Speaker, infrastructural changes are not limited to Princess Margaret Hospital and the Rand Memorial Hospital. The geriatric hospital redevelopment began in February of 2009 and is on schedule with a projected completion date of October 2010. The project of the National Insurance Board for the construction of new inpatient facility at Sandlands Rehabilitation Center for children with special mental health, behavioral, and developmental needs is now proceeding satisfactorily and is scheduled for completion in April of 2010. Mr. Speaker, I'm also happy to announce that the nurses would be getting their insurance, which would come through on or before July 1st of this year. And I hear arguments about funds not being provided, but I can say, Mr. Speaker, that the funds for this insurance is listed under Head 50, Head 5, Block 50. Mr. Speaker, Dr. Margaret Chan, the Director General of the World Health Organization, reminded us at the 63rd World Health Assembly meeting last month that public health must never cease to learn from its successes and its failure. We will bring all of those lessons to bear on the management of all the resources available to us in the upcoming fiscal year. I leave you with the mission statement of the Ministry of Health to ensure that the highest quality of services for health promotion, protection, and care are accessible to all persons of the Bahamas in order to achieve optimal health. Mr. Speaker, I must commend this government. I think it's a very futuristic government. I think it's a very futuristic budget, especially during this particular time. Mr. Speaker, while visiting